the health professionals that young people talk to and engage with are health professionals that are using really good communication skills, and that's probably based on being able to understand where the young person is developmentally, matching language with the young person. So, you know, the health professionals that come in and use words that the young person doesn't understand, you've lost them. So mirroring the young person's language. Getting to know the young person outside their cancer. So the oncologists that say, hey, so-and-so told me you're really into skating, or so-and-so told me that the Knights are your team, I saw they won on the weekend, or whatever it is, to build that relationship with the young person outside of their cancer. Another one that I always say is young people feel intimidated enough. It's often their first experience in the health setting ever. 95% of the young people I come into contact with, I'll often say, have you ever been in hospital before? And generally they haven't, or they'll say, oh, I've been there once when my grandfather was sick. So, and I think we forget that as health professionals because we're always in the hospital environment. They've never had an experience, and they haven't got that part of that brain that conforms with societal norms, like, you know, you need to have your bloods done at 6 a.m. They don't understand why that is. So working with them in terms of their intimidation of the health system. So not standing over the young person, getting down to their level, like really basic things that young people will say to me, the ones that sort of are insightful enough, going, I don't want to talk to that doctor anymore because he just stands over my bed and demands me, or that nurse, she's always like, she's really scary, and it's generally because they're standing up. And that gets the young person, I guess, their back up. And the other thing that I always say to health professionals as well is don't fake being someone that you're not. So, you know, a lot of nurses, etc., will say to me, well, I don't know the latest lingo and I don't know what YouTube is or whatever. And I'm like, that's okay. You can be 60 and work as well as a 20-year-old with a young person if you communicate in a certain way and it's not faking it. So say I don't know what that is. Can you tell me what it is? You know, I don't know what Snapchat is. Teach me about it. Use it to your advantage. And also the other thing young people really always say they can't stand is if we promise them something or commit to something, I'll come back and see you later, and we don't. That's where you lose a young person's trust, because they can't calculate, oh, maybe she didn't come back because she had to see 5 other patients, or maybe this. Nah, you didn't come back. So not to overcommit. Don't commit to things that you don't want, you're not going to do, or you don't know if you're going to do.